Hello, everyone, and thank you so much for joining today's LinkedIn Live. I will just wait a few minutes to see if anyone else has joined, and then we can start. Okay, I think we can start now. Hello again. My name's Aneta Gell, and I'm a Quality Operations and Training Manager at 4R Palmer Limited. And today we are going to spend around 30 minutes looking at one of the most important topics for everyone who is working in pharmaceutical industry, and that is what regulators actually look for when they walk through your door. I will not hear your comments, so if you have any questions or any comments you would like to provide, please put them in the comment section and I will respond to them after the webinar. Okay, so let's start. Whether you are a quality professional or a regulatory affairs specialist, or someone who has sat through more internal audits that you can count, this session is designed to give you a practical, honest insight into the inspector's perspective. We are not going to talk about ticking boxes or polishing documents in the 48 hours before an inspection. What we are going to talk about is what genuinely effective pharmaceutical quality systems look like, and why organizations that build those systems stop fearing inspections. Let's start by addressing a misconception that's surprisingly quite common, even among the more seasoned or experienced quality professionals. Many people assume that a regulatory inspection is fundamentally about documents, that if your SOPs are up to date, your batch record is complete, and your deviation log is tidy, then you will be fine. And it is understandable why people think this, because documents are tangible. You can see them, you can check them, and you can organize them. But the regulators are not primarily a document auditors. They are assessing something far more demanding, which is control, understanding, and consistency. They want to know whether your organization genuinely understands the processes it runs, whether the processes are actually under control, not just described as being under control, and whether the quality system functions consistently every day, not just during inspection week. There's a phrase that I would like you to think about throughout this session and even and after, is that passing an audit does not mean your pharmaceutical quality system or PQS is effective from that point and forever, and you don't need to do anything. Inspection is a review of the sample of your systems, of your documents, and based on that review, you get a verdict. I was at a conference last week in Coventry, and during the MHRA GDP presentation, we were reminded that the licenses and certificates that they issue are valid really on the day that they were signed, a little bit like the MOT you get for your car. And just like the car, the PQS, we need to manage it well. We need to continuously improve it for it to stay in compliance. So inspectors are not there to catch you out, and they are not looking for a perfect system, because no system is perfect. But what they are searching for is the truth. They want to see whether the system that you have described on paper, in your site master file, in your policy, in your procedures, is the system that actually operates on your shop floor. And that distinction between what is written and what is real is at the heart of what we will discuss today. Okay, so what is a pharmaceutical quality system, or PQS? It is a living system and not just a collection of SOPs. As defined by ICH Q10, it spans the full product life cycle and it integrates risk management and knowledge management. Let's remind ourselves quickly what is covered by the life cycle statement. It is development of your product. It is the technology transfer, so from your development stage to commercial stage, and then your commercial manufacture, which could include another transfer to another unit, and then you have the final stage of your life cycle when you have the discontinuation of your product. And PQS covers all four stages of that life cycle. Okay, so one of the most valuable things you can do when preparing for a regulatory inspection is to understand how an inspector actually thinks. Because they don't follow a checklist in the way that we might imagine. They follow a logic. And it's worth mentioning here what the word audit itself means. So the word audit comes from a Latin word audire, which means to listen. We've got the word audio that comes from the same word. So an auditor at their core is someone who listens. They ask questions to understand your systems and your processes. And the best inspectors approach your facility with that mindset. They want to understand how your operation works, not simply to catch you out on where your gaps are. And the primary objective of auditing is to build a mutual trust for the reliable supply of adequate quality product, not to accumulate findings. Inspectors who chase observations for their own sake risk managing the very relationships that the quality oversight is meant to support. I personally worked with some auditors who had that mindset because they felt without the findings, it would be considered that they have not done the job properly. And that is not how it should be done. So going back to the trust building, is that the trust building is the goal here, and identifying genuine weaknesses is the mechanism. And every inspector enters a facility asking the same 4 questions that you can see on the screen. And they are, do they understand their process? Can your people explain at the level of genuine understanding why do they do what they do? Not just the steps, but the reasons behind the steps. Then, is the system in control or just documented? There is a significant difference between a process that is controlled and one that is merely described as controlled. And inspectors are trained to find that difference. Are issues identified and acted upon effectively? Every quality system will have problems, and inspectors know this, but what they are assessing is whether you find those problems before they do, and whether your response is effective and sustained. That's where your kappa comes in. We'll talk about that a little bit later. And the 4th question, is there evidence of learning and improvement? An organization that repeatedly makes the same mistake signals that the system is not functioning as it should. So hold those 4 questions again in your mind as we move throughout the rest of today's session. What regulators look for first. When an inspector arrives at your site, They do not immediately dive into your deviation logs or pull out batch records. They take a stock of the bigger picture first. And there are 5 priorities that consistently shape their initial assessment. The first one is a process understanding across all teams, not just the quality team, but every function. Can your manufacturing operators explain critical process parameters? Can your warehouse staff describe GDP requirements, good distribution practice? Does the knowledge sit only within the specialists, or is it embedded across the organization? The second priority is consistency between written procedures and actual practice. This is one of the most common sources of findings globally. A procedure says one thing, and the practice observed on the floor, on the shop floor, says something slightly different. Even small inconsistencies are significant because they suggest that the procedure is either wrong, outdated, or not being followed. The third one is data-driven decision-making. Every decision in a quality system should be backed by evidence. Inspector will look for the decisions and that they are justified, documented, and traceable. Gut feeling, even if it's correct, is not acceptable without the supporting data. The fourth priority for an inspector or auditor is leadership oversight that is active and not passive. Senior leadership should be visibly engaged in quality, asking questions, challenging trends, and driving improvement. A quality culture that exists only within the quality department is a red flag. And the fifth priority is risk visibility. Inspectors want to see that you understand where your risks lie and that you are actively managing them, not just acknowledging them. Showing an inspector a risk assessment that is in an Excel sheet from 5 years ago does not really provide them with confidence that your organization understands what the risks are and how to manage the risks in general. Now, let's have a look at the specific PQS elements that come under the closest scrutiny. These are the areas where inspection findings are most frequently cited, and none of them should surprise you. First one is deviations and investigations. The question inspectors ask here is, are root causes truly identified or merely documented? There is a meaningful difference here because it is easy to write operator error or training gap as the root cause. It is much harder, however, and far more valuable to dig into what that error, why that error occurred, what systemic factors contributed, and whether similar conditions exist elsewhere. Inspectors read investigation reports carefully, and they look for depth of analysis and for conclusions that are genuinely supported by evidence. The next element is CAPA effectiveness, which is currently the new buzzword. And this is where the organizations frequently stumble. It is worth being precise about the terminology here because ICHQ 10 defines corrective action as one taken to eliminate the cause of a detected nonconformity and preventing its recurrence. A preventive action, by contrast, eliminates the cause of a potential nonconformity and preventing occurrence in the first place. And the important implication is this: once a nonconformity has occurred and become an audit finding, a true preventive action for that specific event is no longer possible. What you can do is correct it and prevent its recurrence. Understanding this distinction matters because inspectors assess whether your CAPA logic is sound. whether actions genuinely address root causes, and whether their effectiveness has been verified. A CAPA that looks thorough on paper but has not been evaluated for effectiveness is a critical gap, and effectiveness check is definitely in the spotlight these days. Let's move to change control. Before any change is implemented, impact must be properly assessed on product quality, on other processes, and on regulatory submissions. Inspectors will look for a thorough impact assessment and appropriate approvals. Rushed or under-documented change controls are frequent sources of findings. Next, we have complaints and recalls. Market signals do matter. When customers or patients report issues, those signals must be investigated promptly and thoroughly. Inspectors will look for responsiveness, for trend analysis, and appropriate escalation. And the last but not least is a supplier quality. Your quality system extends beyond your own facility walls, and the questions are: do you understand your suppliers' risks? Are you actively managing them through qualification, regular auditing, and ongoing monitoring? So supplier oversight is a distinct area of an inspection scrutiny, and a weak management is a recurrent finding across regulatory agencies worldwide. So let's move to data story. Data is arguably the most powerful lens through which an inspector evaluates your quality system, because data doesn't lie, and patterns in data tell stories that no single document can do. Inspectors do not review individual records in isolation. They look for patterns across deviations, out of specifications, and out of trend results and complaints. They are asking, what does this data collectively reveal about the performance and the control of this operation? So what does good look like in practice? It means that the trends are identified early, before they become problems, and investigated thoroughly. It means decisions are proactive on your side based on what the data is telling you, rather than reactive responses to failure. It means data that is complete, internal, consistent, and genuinely accurate. So when you do trending, when you collect your data, look at your data, don't just do trending and put it away. The trending of the data is telling you a lot of information. And then we have data integrity, which is non-negotiable. Every single data point must be attributable, meaning that you can trace it to the person who generated it. It must be legible. It must be contemporaneous, meaning it must be recorded at the time of that action being performed. And it must be original and accurate. Those 5 principles are referred to as ALCOA, and they are the foundation of data integrity. If any of these principles are violated, the reliability of everything built on top of that data is called into question. Of course, we now have ALCOA++, but for today's purpose, we will stick to the ALCOA, which is the core of data integrity. Gaps in records, corrections without justification, unexplained discrepancies, audit trails that have been disabled or tampered with, these are immediate red flags for any inspectors. Data integrity findings are among the most serious that a company can receive, and they can trigger regulatory action regardless of how strong the rest of the system appears. Your data must tell an honest story, and your systems must be designed to ensure that the honesty is preserved. behavior. So I've talked about documentation and data, and now let's turn our focus to behavior, because this is where many otherwise prepared organizations fall apart during inspections. Documentation describes the system, but the behavior reveals whether it actually works. And inspectors conduct staff interviews for precisely this reason. This is why, they like to talk to people on the shop floor. Remember what the word audit means. It comes from the Latin audire, to listen. A skilled inspector is above all a skilled listener. They listen to what your staff say, how they say it, and what they don't say. The way people respond to questions tells an experienced inspector far more than any written record ever could. Inspectors are extremely skilled at distinguishing between staff who have been trained and those who are competent. Training means you have sat through a session and you signed a form. Competent means you understand your role, you understand why it matters, and you can apply that understanding in practice. The difference is unmistakable in an interview, and that warning triangle on the slide is there for a reason. This is one of the most common underestimated risks in inspection preparation. So there are 3 things inspectors listen for, and they map directly to what you can see at the bottom of the slide. Do they understand why? So, can staff explain the purpose behind the procedure? Not just what they do, but why they do it. Are answers consistent? When the quality team, the manufacturing team, and the warehouse team all describe the same process in the same way, it signals a genuinely embedded culture. When they describe it differently, it raises questions about which version is the real one. And then we have the confidence or hesitation. Hesitation doesn't necessarily mean people are doing something wrong, but it raises immediate concerns about system ownership and whether quality is truly embedded in everyday working practice. One further point worth making here is that inspectors are also highly attuned to the body language in the room, the dynamics, so who speaks, who looks to someone before they answer, who shifts uncomfortably. This is why genuine competence development, not pre-inspection coaching, is the only preparation that actually works. And this is why quality culture matters so much more than quality documentation. Let's have a look at the common inspection failures now. What are the patterns that recur across inspections globally, consistently, and unfortunately, predictably? I want to emphasize what the slide says here. None of these is inevitable. Every single one of these failure patterns is preventable with a well-embedded, genuine quality culture. So let's have a look at them in turn. Superficial root cause analysis. This is the largest circle on the slide, and that sizing is deliberate because it is the most pervasive failure of all. Symptoms are treated, but the underlying cause is never truly addressed. An investigation concludes operator error or a lack of training without asking the harder questions. Why did the error occur? Questions like, what in the system allowed it? Are the same conditions present elsewhere? Root cause analysis that stops at the surface is not a root cause analysis. is a documentation of a symptom. I have seen so many root causes documented that were actually symptoms of the root cause rather than the root cause itself. So provide quality training on your root cause analysis. Make sure staff understand the difference between the root cause and the symptom, and understand how to ask the 5 why questions to get the appropriate answers. Then we have ineffective CAPAs. Actions are taken, but they don't resolve the real issues. Perhaps the CAPA addressed one isolated occurrence rather than the systemic condition. Perhaps it was implemented but never really verified for effectiveness. And inspectors look for evidence that actions actually worked, not just evidence that they were taken. A closed CAPA with no effectiveness check is one of the most common findings across all major regulatory agencies. You should have a justification why you don't need effectiveness check rather than have a justification and the other way around. To illustrate this for you, I would just like to use a quick example. So you have an internal audit finding where you have missed stability data from a number of the products from your CMOs. You are a manager who manages external sites, and the investigation identifies that the root cause, there is no oversight of the data. No one asks for it, no one knows when it comes. So the CAPA is created to update the stability management process to include a documented quarterly review of the status of the stability data from all CMO. And historically, in so many cases, you would see the effectiveness check as effectiveness check is, has the SOP been updated in the timeline provided? But that is not an effectiveness check of our CAPA because it doesn't assess the process that we've put in place. So your effectiveness check in this case would be that you set up a check in between 6 to 12 months and to see whether your stability data status is in compliance, which then would tell you that your CAPA for quarterly documented reviews is effective and is managing the stability data in the way that you were hoping your CAPA would. If you still find gaps, then you can see your CAPA is not effective, and then you have to rethink and go back to a drawing board. Overcomplicated systems is the next common inspection failure. Ironically, quality systems that are too complex or too layered are too difficult to navigate. They often perform worse in inspection than a simpler and well understood quality systems. If your own people cannot navigate the system confidently, then it's not protecting the quality, it's creating a risk. So complexity that nobody understands is not a quality system, it is a liability, isn't it? Then we have poor cross-function communication. Quality problems rarely respect departmental boundaries, but quality conversations very often stop at the boundaries. When manufacturing, quality, supply chain, and regulatory affairs operate in silos, problems fall through the gaps between functions, and inspectors notice this quickly, particularly when answers from different departments contradict each other. And then inspection-only behavior. This is perhaps the most telling failure of all. The sudden improvement in housekeeping, the documentation discipline and attention to detail that appears the week before the inspection and then vanishes a week after. Experienced inspectors will recognize this pattern without a failure. and it tells them everything they need to know about the quality culture they are looking at. So what is striking is that all 5 of these failures should have been identified internally before any external inspector arrives. Well-functioning internal audit program, which is required by EU GMP Chapter 9, is there precisely for this reason. It should catch these issues and resolve them before the inspector finds them. If it's working properly, an external inspection should rarely surface any surprises. So what good audit readiness look like? True readiness is not a sprint before an audit. We have all experienced that. I definitely have. But I have also experienced when it is a sustained state of operation. And I want to spend a little bit of time on each of these 4 pillars, because together they describe something quite different from what most organizations do in practice. So, everyday systems, processes that work consistently, not only when the inspector is present. This sounds obvious, but it is where many organizations fall short. Genuine readiness means that the way your team operates on a quiet Tuesday in July is identical to the way they operate when a regulator is standing in the room. If you would like to change anything about your documentation, your housekeeping, or your communication when an inspector arrives, that gap is your real compliance risk. The goal is to eliminate that gap entirely. It is worth remembering that inspections are spot checks by nature. So inspectors cannot see everything. They take a sample, which means every area, every record, every process needs to be in a good order at all times, because you cannot know in advance which one they will examine. Real quality is when we do the right thing when no one is looking. And that is the state you want to achieve. And that is what a good culture, quality culture, is about. Next part is risk kappa linkage. A clear connection from the risk identification through investigation to verified outcome. This is the unbroken chain that the inspectors look for and rarely find. You identify a risk, you investigate, you act, and critically, you verify that the action worked. Too many organizations treat kappa closure as the finish line, and it isn't the finish line. The effectiveness verification is the finish line. You need to check that the kappa you've put in place has been effective and has done what you were hoping that it was going to do. When inspectors see that the full chain operating consistently, they see a system that is genuinely managing quality, not just documenting its intentions. And then we have leadership engagement. Seniors, leaders need to be visibly active in the quality, not a passive recipient of reports. This is a cultural signal that inspectors pick up very quickly. When quality is something that happens to senior leaders, something reported to them in a monthly meeting, it tells an inspector that quality is not truly embedded at the top of the organization. But when the senior leaders are asking the questions, they want to know about the trends, they challenge the teams over the overdue kappas, and visibly driving the improvement, it sets an entirely different tone. Leadership engagement is not a nice to have. It is a foundational indicator of a quality culture. And then we have culture of transparency. Accountability and continuous improvement is woven into your daily working life. This is the hardest pillar to build and the most valuable. In organizations with a genuine transparency, people raise concerns early rather than hoping that problems will resolve themselves. Deviations are reported promptly because people understand that surfacing an issue is the right thing to do, not a risk to their reputation. Accountability is seen as a professional standard, not a punishment. That culture cannot be created in weeks before inspection. It is something that is built over months and years through leadership behavior, through how findings are responded to, and through the signals an organization sends every time something goes wrong. When all four of these pillars are in place, inspections become what they were always meant to be. Not a test of your organization, but a confirmation of it. The best quality culture is when we do the right thing when no one is looking. That is the state you want to achieve. And I've said it on the previous slide, and I'm saying it again because that is that in a nutshell. I would like to close with what I think is the most honest thing I can say about the regulatory inspections from a personal experience. You can prepare for inspections so they run smoothly, but for it to be successful, you and your organization, you must live in an inspection mode. Audit readiness is not something you achieve in weeks before or the visit. It's not a state of preparation. It is a state of operation. It is what your quality system looks like every day. Ask yourself honestly, if a regulator walked into your facility today without notice, without your team being able to explain your systems, would your team be able to explain your systems with confidence and clarity? Would your data support your story? And would it be complete and accurate and without any gaps? Would the decisions your organization has made over the past 12 months hold up under the scrutiny? I personally follow a simple rule at work. Can I defend the point in front of an auditor with solid evidence? Can I support it by data? If my answers are yes, then all is good. And these questions above, they are not rhetorical questions. They are the actual tests your organization faces every time an inspector arrives. The organizations that consistently perform well in regulatory inspections are not the ones that prepare the hardest in the final weeks. They are the ones that never stop being ready because they build systems that work, culture that cares, and habits that persist regardless of whether there is an inspection or whether there is an inspection. We have come to the end of today's session, and I would like to thank you very much for your attention. If you would like to know more about the topic, if you would like to follow or continue the conversation, learn more about the pharmaceutical quality system, audit readiness, explore our tailored training solution for your team, root cause analysis training, CAPA, please visit the Academy of Pharmaceutical Excellence. And you are also welcome to reach us directly at the academypharmaceuticalexcellence.com, or if you prefer, you can contact me at aneta.gel@pqs.ltd. I genuinely hope this has been helpful. Thank you for your comments. I will respond to you after the webinar. Look after your quality systems and they will look after you. Thank you very much. Have a lovely day. Bye-bye.